Right, thank you for staying with the Monday Report. We're beginning this conversation right now, and you'll see me shuffling through my gadgets because I'm trying to get in as many questions from you as possible. And let me introduce my guest real quick, beginning from my immediate right, Dr. Uma Oluga, KMPDU Secretary General. Thank you for making time. And also Dr. Moses Masika, virologist from CAVI ICR, which is the Institute of Clinical Research, and also a lecturer at UON. Thank you so much for making time. Let me show you one thing. So this is a meter distance, all right? It's about arm's length. They say because I'm a tall guy, so it's probably slightly longer than that, but yeah, caution is better. Dr. Uma, first of all, let's start with some basics. I have a sanitizer here with me. How much of it is enough? Just if you can just demonstrate.
Yeah, I think just one push is enough. But you make sure you rub it properly across with the in between as well. Okay. You know. Yeah, make sure that it's all over. Okay. Yeah, but also I think maybe Masika is well placed to say this, that what we need to really emphasize is washing hands with running water and soap. So the sanitizer is an alternative. Okay. It's not the primary thing. So if you have running water and you have soap and you can wash your hands for at least according to the CDC, 20 seconds, and again you do adequate scrubbing, adequate scrubbing with running water, then I think that is very effective, way more effective than sanitizers. Also, if you're using sanitizer, it's alcohol based, and the percentage should be, is it more than 85?
70 is good.
70 Why is washing hands a better option?
Well, imagine you've been working in the farm. You have lots of mud on your hands. The sanitizer will not work. Or if you run a garage and you have a lot of grease, the sanitizer will not work. You actually need soap and water to clear that debris, and then the germs can be destroyed by the soap. Okay. If you use a sanitizer in that case, then you're not doing anything.
All right. So Dimunene says, concerning this corona thing, how long can the virus endure in a pool water, and can the chemicals used to manage the pool suppress the virus to prevent spread from one swimmer to the other?
It's an interesting question. Pools should be chlorinated, and that is just normal bleach. It destroys the virus if they use the right percentages. So it wouldn't survive in a pool.
Okay, and then we have another one here. Trevor, please ask, my better half works for an airline cooperating routes Addis, Dar, and Nairobi. Will he need to be quarantined for 14 days before? Okay, I wouldn't read the rest.
Yeah, I think the president made that very clear in the speech about international flights and Kenyans who are coming in. And the advice to, ideally we should quarantine them, but I think the country has still allowed some measures of self-quarantine. Yes. But ideally we should isolate for 14 days. I also have a few friends who are still outside there, and they have been asking me that question. The recommendation is to actually isolate them, especially if they are traveling from Europe, which is the new epicenter. There are also a few countries that were listed, South Africa, I think, is one of them also. So far, we've not had any East African countries like Dar es Salaam being an epicenter. I think they just reported the first case today. Yeah, but so far, anyone who is traveling into the country, I think it would be very important that they self-quarantine. Yeah, but the recommendation would be that they should be isolated.
Okay. Yeah. Dr. Masika Kiprop Dixon says, I'm from Eldoret, but out of curiosity, normally when a person has the common flu, you must have heard that a little bit of whiskey clears the flu. With coronavirus now, with both viruses, can it help?
Whiskey doesn't clear the flu, it doesn't clear coronavirus. I think that's the most we've clarified this quite a bit. I think that's the best we can do. You can't use alcohol and say that you are fighting the flu or fighting corona, unless the alcohol is in the form of a sanitizer.
And then it only kills the virus in your hands.
Yes, don't drink it.
Don't drink it. All right. So there's another one here. Please, what are the symptoms of coronavirus and why should you wash your hands every time? That's from Pastor Okana.
I think the recommendation for regular washing of hands is the fact that we touch surfaces. Again, perhaps this is very scientific. I was reading some very rudimentary research from the NIH, the National Institute of Health, which is like the US government body that deals with the issues of public health. And they were talking about the amount of time the virus takes on surfaces, whether it's cupboards, whether it's plastic surfaces on the hands. And the good thing that the virus, from the scientific research and the family it belongs to, is enveloped. So it's also shed off very well with just washing. So the regular washing is very effective, and the regularity depends on, because you're touching surfaces. It's not that you wash your hands now, then you go greet someone, you're going to touch a plastic, you're going to touch a cupboard. So just in case someone who was either infected or someone sneezed across and touched, then you have to really I don't know the recommendation for how regular this washing is. I know the duration. Some people say 30 minutes, an hour, but it actually depends on your risk of exposure.
What you're doing, where you are. And I think it's important to add that it's not like touching the virus will transmit it to you directly through your hands. Okay. Usually it's because you will then touch your face with your hands. And when you touch your nose, your mouth, and your eyes, then you're putting yourself at risk. And that is why you need to clean your hands, because you're most likely going to touch your face several dozen times, at least 20 times in an hour or so.
Okay, so it's about 20 times. There's
on average.
There's another concern about masks. Should we be wearing masks on the street?
No, I think this question has been there throughout. So first of all, I think because it's really related to health workers, I have to address the fact that we are having a global shortage in terms of the supply chain has really diminished. So we are saving masks for those who really need them. And there are three categories of people who really need them. One are the health workers who are exposed. And when health workers or frontline workers, there are also some workers in basically high risk, like immigration at the airports and then those kind of workers. Then number two are the people who will be taking care of the coronavirus affected patients, which for now I don't think that we have recommended that anyone takes care of them.
Not yet.
So far we don't have that category in terms of the people who will be taking care of them. And then the last are the patients themselves, so those are the categories of people who need masks. So we don't need masks in the general population, so we don't really need to wear it unless you are the patient, unless you're a health worker or a frontline worker, and you are a caretaker.
Okay.
So you're either sick or taking care of the sick.
So you don't need to walk around with masks on the street like we see people do?
No. Okay. Unless you want us to take you and quarantine you.
Doesn't it help though if you're infected so that you don't spread?
It does.
If you are, yes. That's what I'm saying. If you're sick or you're taking care of the sick.
Okay.
Yeah.
Ronald says, I have so many people going for sanitizers and other expensive soaps. Can the ordinary kipande do the cleaning effectively?
Yes, very effectively.
Very effectively.
Soap.
Okay.
Any soap will do it.
Robbie from Kitale says, we are worried as residents of Kitale, for we are informed that the first lady was here. The lady was diagnosed with COVID-19 was here. What should we do?
I cannot confirm that the lady was in Kitale. I don't have that information. I don't know if Ouma or Luga has.
Yeah.
But even if she was there, the contact has to be quite close. It's not like because somebody is in Nairobi, everybody in Nairobi is exposed. So the contact has to be quite close. Either people that are sharing a house or people that they shared a common space together would have been exposed. But I don't know where she went. I don't have that information. I might have missed it. Maybe Oluga can clarify.
I think the government, again, there is a lot of issues surrounding disclosure or patient confidentiality. So sometimes I think that is left to the authorities. That's where you have to trust the healthcare system. But I think the government already announced that they were doing the contact tracing and the movements. So I think for purposes of that confidentiality, we would leave that information to the government.
Okay. Terry from Odaya says, my question is it true that people with underlying health conditions are at higher risk of being infected with the coronavirus?
Yes. Generally, what has been reported in countries affected is, and you just noticed I touched my face.
Yeah.
So yes, that's why it's very important for people to regularly wash hands. But what has been seen in other countries are the elderly people, and not just elderly people, but elderly people also who are either critically ill in hospitals, also who have what we call comorbid conditions, or basically conditions that are either affecting the lungs or the heart, or that already impair you from breathing, such as like asthma, people who have chronic airway obstructions, people who have heart failure, people who have uncontrolled diabetes, people who have, as I mentioned, even some cases of, it's called what, sleep apnea thing. Well, how can I translate sleep apnea? So yeah, those kind of cases. So there are specific groups that are more affected, but I think that has to come with a caveat that the virus can affect everyone, and we were discussing this earlier. We saw in the Chinese population, some of the people who are dying were also quite young. You saw the first doctor, the whistleblower, was just 34 years old. The hospital director was barely in the 50s, and we've also seen a number of like nearly the 2,900, nearly 3,000 health workers that were affected in China. They are between 25 years and some of them 45 years, quite a number of them. So it can really affect anyone.
Hold that thought for a bit, Dr. Masika, I'm coming to you. We have a caller online, Felix Omondi from Komarok. Felix, good evening.
Okay, good evening, Mr. Trevor.
Good evening. Go ahead with your comment or question, sir.
Okay. First of all, thanks for your good work.
Asante.
Okay, my question was...
yes, sir.
Maybe if you can just ask Dr. Oluga...
yes, sir.
How effective are these equipment at the airport or maybe at the border?
All right.
How fast can they detect the virus using those equipment?
Okay. Thank you, sir. Direct to you.
Yeah,
how effective are these equipment?
I think that's really a question for the government. But also, I don't think that there's anyone who is detecting the virus at the points of entry. So that what is called Felix? Felix, yes, Felix. Felix and the other viewers should be informed that what is happening at the airport is screening, and screening basically is identification of patients of people who are at high risk or who may have been exposed. So either related to where you are coming from or what you are showing at that time. And what we are doing right now is doing the temperature. The temperature, or perhaps people who have a cough, a sneeze, but mostly I think it's tracing from where you have traveled from.
And it mostly traces the fever as well. So there's a chance you can beat the system if you take suppressants or fever. In fact, Colonel Laguna said it today.
Yeah, there's a chance that, and there's even a chance that there are people also who are already in the infective stage, but they are not showing any symptoms. I think, as has been said, there has also been reported cases of people who are actually asymptomatic for quite some time. Asymptomatic means
no symptoms.
They are not showing any signs of sickness. So that's possible.
It's important to point out that screening is not just happening at our airport. Countries that have these cases are also screening where the people are leaving their airports, which means not one method is being used to control this. So the screening is happening. First of all, the places that are hotspots are under lockdown, so you cannot travel from those places. And for the countries that have had a few cases, they're also screening at exit so that you don't expose other people. So it's not one strategy only that is being used. There are different stages of this screening. Okay.
We have another caller online, Bore from Mandera. Bore, good evening. Good evening, sir. All right. That's we seem to have lost him there. We're talking about the issue of whether you can beat the system. And M. Dawes on Twitter says, can it be transmitted from mother to unborn baby?
There is a lot of interesting data coming on now, showing that a lot of women who have had babies in the last few months were not transmitting to their children. But what I would like to say is, these are women in the last 3 months of pregnancy, which is usually not a very bad time compared to having an infection much earlier in the pregnancy before the baby is fully formed. So in the next few months, we'll be seeing babies whose mothers were infected earlier, and then we can have more information to know the risk. Right now, what we are seeing is not very detrimental. We are seeing that most people who are pregnant and get COVID-19 are able to go ahead and have healthy babies.
Okay.
But it's possible, of course, from close contact to transmit to the babies, although we would also like to see what happens during infection if the mother is pregnant but earlier in the pregnancy rather than later in the pregnancy. That is usually much more dangerous.
Okay.
Yes.
And Susan here on Twitter says, good evening, Trevor. I have a concerning question about our children traveling from schools from other counties. Will they use public means of transportation, or the government has catered for that? I think that was clarified earlier on by the Ministry of Education, where they said the schools should organize for that. Parents should pick their children where possible. And also, if schools don't have buses, they should organize with NTSA registered vehicles, which should then be sanitized before they go and pick the students. And only the students should be picked, not anybody else en route. But this question can apply to you. And will they have to be self-quarantined once they get home? That is still a continuation from Anne Susan.
So these are students who are coming from an institution that did not report any cases.
Yeah.
So we do not need to quarantine them.
Okay.
If they had a case, then we would be thinking about quarantine. And the reason we are actually closing schools early is to avoid such a situation where you have a case in one school and then it's dispersed across the country, because the children tend to come from different parts of the country. So we don't need to fear these kids when they come home, because they've not been infected. So far, we've not had a case in any school. So we don't need to quarantine them.
All right.
Yes.
We have another call online, Maximilian Kome from Meru. Maximilian, good evening.
Good evening.
Yes, Maximilian, go ahead with your question.
My question is,
Yes, sir.
when somebody dies, does he or she spread the disease to the ones who are left?
The ones who are handling the body, you mean?
Yeah, the ones who are handling the body.
Okay. Thanks, Maximilian.
Yeah.
It's possible, of course, when somebody has died, if you handle the body, to get infected by different pathogens. And we suspect even with COVID-19 that is possible.
Okay.
So there has to be measures, especially at the morgues, to prevent infection. And the people who at some point are handling this will need to have the right gear. So when you're handling bodies, you don't just handle them like you would handle, you assume they're infectious. So you make sure you're protected. And that's something I know the pathologists in Kenya are actually discussing to make sure that if we get to lose people because of COVID-19, the people handling these bodies are actually well protected.
Okay.
Yeah.
Dr. Umoluga Demetrius Mududa says, how is the union ensuring that the government will ensure the safety of their members during this time?
Yeah, actually, no, Demetrius.
Hi, Demetrius.
Yeah, hi, how are you? Yeah, he's quite a sharp gynecologist. And that has been quite a concern today, and not even today. I think we've been talking about preparedness for quite some time. The last time we were with you here on Wednesday, and we mentioned that the government has done something, at least in the last 2 weeks. We cannot just throw away all the effort. I think also it's good to give them credit. But I think they concentrated on the infrastructural bits in terms of setting up the isolations, in terms of trying to ensure that facilities, whether at the counties or at the national level, have some level of a room where they can put people, and also the measures they took in terms of airport closures and the schools. I think those are really commendable.
Yeah.
But I think one gap that we have seen, which we even said on Wednesday, is dealing with the health workers. And I think the last time I was here, I said that the confidence of health workers needed to have been assured. And that confidence is assured by making the health workers have protection. And protection means gloves, it means boots, it means gowns, it means goggles, it means masks, you know, it means disinfectants, and sometimes they are not the kind of disinfectants like the sanitizers, you know. Okay. There's the sprays, for example. And it also means clinical management protocols. I know that the ministry today has been locked down with a number of professionals in the afternoon, just trying to to get down to what are these protocols like. There are so many protocols for dentists, for example, because when you go with a tooth problem, the dentist is very close to you. When you go to the ophthalmologist, the ophthalmologist examining your eye is very close to you. When you go to see whichever kind of a health practitioner, the nurses, for example, the clinical officers, everyone. So, and you saw today there was a go-slow at Mbagathi, because the nurses are very worried. There are people in that hospital who are being isolated. They have 3 patients who are already being treated. And even the normal, what we call surgical gloves were not, surgical masks were not available to everyone, from the watchmen to the health workers. So we released a statement today as a union. And in our statement, we were very clear that health workers must, number one, protect themselves. And I know that this is a very hard directive to give, and I think all health workers must know that you owe yourself protection. I think that is something that they must get very clearly. You owe yourself protection. But having said that, we also know that the crisis is for all of us. The crisis is for the government as it is for us. And this is the time that we wish, for example, the things we have been saying before, even in our CBA, get us call rooms, get us equipment, get us this. This is the time really that you can now see that we've been doing these things in the public interest. Because right now, health workers, for example, who are going to get into contact with patients or with people who are isolated, they shouldn't go home to their families because they may spread the virus to their families. At the same time, they should not even be using the public transport because they also put you at risk. So we need to have what is called holding rooms in the public facilities. These holding rooms are supposed to be fully furnished with personal effects, food, and those disinfectors and protective gear. And then after, for example, when we go into a full-blown crisis, or should the cases increase, then the health workers who have been attending to these patients, for example, for 7 days, also need to go on a quarantine for another 14 days. So that means you need to replace them. So there already is a huge shortage, and we want to thank the president because he was very clear in his statement that we must employ health workers, additional health workers on emergency. And for us as a union,
come to you to give us more recommendations from the KMPD perspective on what you'd like to see henceforth. But we have another call online. Honorable Mule is the Matungulu Member of Parliament. Honorable, good evening. It's good to speak to you. What is your question concerning this issue, sir?
Thank you, Trevor. My question goes to Masika. We know very well.
Yes. Go ahead.
We know very well that these viruses are a bit difficult, and we know they mutate when they get into bodies of human beings. With coronavirus, Dr. Masika is a biologist. What is the mutation channel of this virus?
What is the mutation?
Honorable Mule from Matungulu, Member of Parliament, is wondering whether it mutates like all the other viruses once it affects someone.
Yes. Now, to put this basically, this is an RNA virus. Other viruses are DNA. RNA viruses tend to mutate a lot of times, and as it infects more people, it could mutate, and mutations can bring in different characteristics. It could be able to spread faster. It may be able to cause more severe illness. It may be able to cause less severe illness. So mutations occur all the time, and it's difficult to predict what the next mutation will be, but we know it will happen. So
we know it's mutated.
Yes,
this we know for sure.
But the good thing is that most of the mutations actually make the viruses less fit, so the viruses may actually die off. But once in a while you get a mutation that makes the virus stronger and able to either avoid your immunity and reinfect you, or to, in some instances, escape if you've developed a vaccine or even medication.
So at this point now that we don't have a vaccine just yet, is there a chance that we'll get a vaccine and then it mutates?
The challenge will be in getting a vaccine that can cover all the variants first. And if you do get one, then how long does the immunity last? So there are many challenges of vaccine that we can't get into right now. It suffices to say it takes a while to develop a vaccine that works because of these mutations and how long the immunity will last from the vaccine.
Renor says, how do we protect children under 1 year?
Renor, children under 1 year will still be under the same risk as the people around them, except of course for them they don't touch lots of surfaces. But if the person who who is taking care of them, the minder, suspects that they have been exposed as a minder, then they should avoid interacting with that child. And that is the best way to protect the child, so that you keep them in a place away from anyone who may have been exposed, so that they do not infect the baby. Because the baby can't move much. You have to yourself move and make sure you're in a different space with the baby. That is the best that you can do. And clean the areas or surfaces around the baby. Before you attend to the baby, wash or clean your hands, so that you don't contaminate or the baby with from another source. So you clean your hands before and after attending to the baby, if you're feeding them, if you're cleaning them. And if somebody has been exposed, then they need to take the trouble to avoid interacting with that baby.
Okay. Joy from Kitui says there is some information that some of the drugs used to treat this virus are the same as ARVs. What is the relation to HIV? This is not the first time that we are reappropriating drugs. One of the other drugs that is used to treat this virus is also used to treat malaria. It's called chloroquine. So the reason that we've been able to use the drugs for HIV is because one of the structures in this virus seems to have some similarity with one of the structures that we use, or that is targeted for treatment in HIV. It's totally coincidental, and it's because the enzymes that these viruses use sometimes tend to be similar. And for that reason, this drug that was developed for HIV is able to cut across and treat this virus. And it's not the first time. We have drugs that treat different viruses because of these similarities in the basic structures of the virus. Okay. And
so
Vivian.
still under trial. Yeah?
Yes, and true, actually, that's a very important point, that this is experimental, that we've not proved that it works. We can't say that it is a clear treatment. It's that people have used it, they think there's a benefit, but we cannot say for sure until we test it and say that, yes, this is acceptable as a treatment.
Okay. I'm about to take a break here, but Dr. Umoluga, Daniel Cheruiyot from Kapsabet says, can the screening show if a person is infected just some few hours or one day after the infection? And number two, is the coronavirus a curable disease?
People have recovered. I think you were showing earlier 77 people, 77,000 who have recovered. Curable, I think we are yet to see the long term because there's also some cases of reinfection or re-emergence. We're not sure whether it's reinfection or re-emergence, so because still someone may recover and then go to the community and get the infection again. But there are cases of that. The other thing about the virus in terms of whether you can detect it 1 day or 2 days, I think we've seen that it takes about 5 days for it to start showing symptoms, but could be even up to 14 days. And at the time that it's showing symptoms is when, I think the test that we're using now is a swab, where you either isolate the virus or you test the component of the virus, the DNA or the core of it. So 1 day would be a bit too soon for us to say. I think 5 days is more like it.
Okay. Yeah. Before I take a quick break now, Roslyn Obala says, please ask if the virus can survive in hot climate condition.
Yes, it could, because we've seen infections occurring in tropical Africa, which is fairly hot right now. So we can say from that evidence, yes, it does. We think it may slow down, the hot climate may slow down the ability to spread, but there's no evidence to suggest that yet. We are seeing an increasing number of cases in Africa and in South America, which are very hot at the moment, and even in Australia. So for now, we cannot say for sure that the hot climate does much to the virus. What we know is that these coronaviruses will survive a shorter time in hotter temperatures than in colder temperatures. When it's cold, like if it's on the surface, it will last much longer. When it's hot, it will last a few hours.
Okay.
So we don't have the evidence to say for sure it cannot survive in hot climate, but it is a likely or a logical assumption to make that there may be some benefit being in a hot climate, although it is not, the evidence currently doesn't support that.
All right.
Maybe I can ask him, because I see the sister virus, the SARS coronavirus is heat. I mean, it can be destroyed by heat, by boiling. So is there anything about this particular COVID, whether it can be destroyed?
Any virus can be boiled and boiled to death, literally. So what we've seen on surfaces, viruses can survive up to about 40 degrees for a few hours, especially coronaviruses. But if you boil or cook or heat it, then it will be destroyed just for a few minutes. So no virus can survive in hot temperature, for example, boiling or cooking. So for sure that would be a way to destroy it. But then I don't think our conditions here get to that level.
Because then we'll be boiling ourselves.
Yeah, but that is important because I think also the concern people have is whether vegetables or meat that they use. So I think if you boil your food well,
if you cook it
well, then I think people should be rest assured that you're not eating the virus.
There was actually that question in terms of how long does it stay on a fruit or a vegetable.
Yes.
Yeah. So you just, if you clean it, it's fine. If you boil it, you're good to go.
Yes. Of course, we are not saying you start boiling mangoes. You have to clean, but for foods that you cook or boil, then that's...
Okay. And also, but for things like skuma wiki, it's a bit hard to boil them a lot because we like to take them when they're still green.
At least the heat gets to above 60.
60 degrees is enough, or maybe 15 minutes or less will be enough.
Okay. All right. Let's take a quick break here on the Monday Report. It's a special town hall. The phone lines are open. You can call in 0742961339. You'll be live on air and you can ask all the questions you have in regards to coronavirus. I have so many of them on Twitter, Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. Also, you can text in on 22422. Just tell us your name and where you're texting from. I'll squeeze in as many of them as I possibly can. We're back in just a bit. This is the moment we separate fact from fiction. Like I mentioned earlier on, if you didn't hear it at Citizen TV, it didn't happen. All right? We'll see you in a bit.